So eating habits is a really good place to start, and the next place to go is really looking at our physical activity. Being active, we know, strengthens our heart, it lowers our blood pressure and reduces stress. The NHS recommends 150 minutes a week, so that's just 30 minutes a day for 5 days a week. Get a couple of days rest in there. And it doesn't have to be at the gym. It could be brisk walking, cycling, dancing, swimming, they all count. Even break it up into 10-minute chunks if that's easier and add those up. For example, try walking to the shops instead of driving, taking the stairs instead of the lift, or getting off the bus one stop earlier and walking the rest of the way. We know that nutrition can have a really, really big impact, but we also know that when we add movement to that, then that will enhance the effects of nutrition changes on our ability to protect our health. This is really important, especially for women. As we get older, we are at much greater risk of cardiovascular disease when we go through menopause. And so we will really want to be looking at things like strengthening and resistance training that's going to both provide cardiovascular protection and also bone strengthening as well. Now, excess weight, particularly around the waist, raises the risk because the way that this fat behaves in the body. Now, this is what we call visceral fat. It surrounds our vital organs, like our liver, our pancreas, and it's more metabolically active than fat that is normally stored under the skin and spread out through our whole body. We know that sort of fat also releases inflammatory chemicals, which are known as cytokines, that can damage blood vessels and make them more likely to develop fatty deposits, or what we call atherosclerosis. It contributes to insulin resistance, so that raises our risk of type 2 diabetes because our bodies are much less sensitive to the effects of insulin, so our blood glucose levels remain higher, which in turn also increases our cardiovascular risk. It increases our blood pressure and cholesterol, especially the LDL or the bad cholesterol, by putting extra strain on the heart and the arteries. Altogether, this combination of high blood pressure, abnormal cholesterol, insulin resistance, and inflammation is sometimes described as metabolic syndrome, and it strongly predicts the future risk of heart disease and stroke. So that's why measuring waist circumference can often be a better indicator of cardiovascular disease than weight alone. Stress and poor sleep also increase our risk, our blood pressure and unhealthy food cravings, and therefore leading to an increased risk of cardiovascular disease developing by a few different ways. We know that the stress response, when our body releases hormones such as adrenaline and cortisol, that these cause the heart to beat faster, blood vessels constrict or narrow, which raises our blood pressure. And if stress is frequent or long lasting, then this constant pressure on the cardiovascular system increases the risk of high blood pressure, hypertension, stroke, and heart disease. We know that poor sleep is going to cause cardiovascular strain. So the lack of quality sleep disrupts the body's natural regulation of blood pressure, which normally dips in the night. Without this rest period, our blood pressure stays higher for longer and raises our long-term cardiovascular risk. Both stress and sleep loss increase cortisol levels, and cortisol drives our appetite, especially for high sugar and high fat foods, because the body thinks that it needs quick energy because we're in danger, we need to fight or run away. Poor sleep also lowers the level of two really important hormones that regulate how full we feel and when we stop eating, and these are called leptin and ghrelin. It causes them to switch roles, so we never feel full and we're always feeling hungry, and makes it harder to resist those really unhealthy snacks. This then becomes a really vicious cycle, stress leading to raised blood pressure and cravings for unhealthy foods. Poor diet and ongoing high blood pressure then lead to a greater strain on the heart and arteries. And this cycle can accelerate the development of atherosclerosis, those fatty deposits in the arteries, and significantly increase cardiovascular disease. So find a way of reducing stress, and this can be different for everybody. A few suggestions there are activity, so moving our body more, whether it's going for a walk, whether it's going for a run, going to the gym and punching the punch bag. This is going to improve your cardiovascular health, and it's also going to reduce stress. Whether maybe it's something more peaceful like mindfulness, relaxation, journaling, having a long bath, whatever it is, it's a good way to reduce cortisol levels and therefore reduce stress, and changes in our hormones and neurotransmitters that regulate our cardiovascular system. Smoking and alcohol, these are two very, very big areas where we can modify our cardiovascular risks. And stopping smoking is the single most effective intervention to prevent cardiovascular disease. Toxins in cigarettes, like I said, injure the lining of the arteries, making them more prone to the fatty buildup. It is never too late to quit. There are lots of benefits to stopping smoking, like having more energy, breathing easier, improving your fitness levels, having a much better sense of smell and taste, and of course, a reduced risk of heart attack and stroke. After just 1 year of quitting smoking, your risk of having a heart attack is half that of a smoker. And you can find lots of support and information to help you quit online. So there's the How to Stop Smoking from Public Health Scotland, and the Quit Your Way programme is something you can literally walk into any community pharmacy and they will sign you up for the smoking cessation service completely free of charge, where you can spend 12 weeks working through nicotine replacement products that suit you, that are going to support you to reduce cigarettes and or vaping, and help you to become completely stop and give up. Set a quit date, tell your friends and family, they can help you to stick to it. Have healthy snacks and drinks at the ready to help with those unhealthy cravings, and don't be afraid to ask for help. Like I said, your local pharmacy is there with a free service that they really want to benefit as many patients as possible. So what about alcohol? Alcohol, we generally want to stick to less than 14 units per week. There's a bit of a diagram there to give you an idea of what 14 units actually looks like. 7 double whiskies, 6 pints on average of strength beer, 9.3 glasses of champagne, or 1.5 roughly bottles of wine. Cutting down on alcohol you can drink can help maintain a healthy weight. It's going to improve your sleep and also protect your heart. Drinking can be a really big part of socializing or simply your weekly routine, but there are ways to make it easier. And there's manageable swaps to help you cut down. So, for example, try having half a pint instead of a pint, a small glass of wine instead of a large glass of wine, try a wine spritzer with soda water instead of a large glass of full-bodied wine, a single measure of spirits with a mixer instead of a double, or choose alcohol-free or low-alcohol beers, wines, or spirits. And or for every drink you want to have plenty of fluids and water instead.